Welcome to my channel Medicine Guide. Thank you for coming on my channel. Please subscribe to my channel Medicine Guide. In this video, we will discuss about 7 greatest warnings for beginners before Valium use. But before that, we should know some basic information about Valium, that is what is its generic name, its drug class. So Valium is a brand name and its generic name is Diazepam. And Diazepam is a medicine of the benzodiazepine family that acts as an anxiolytic. It is thought that Valium works by enhancing the activity of certain neurotransmitters in the brain, and it works by helping your nervous system calm down. Its pregnancy category is C, and its routes of administration are oral, intramuscular, intravenous, rectal, and nasal. Its bioavailability is 76% through oral. It is 74 to 97%, and through rectal it is 62 to 98%. Its addiction liability is moderate. Now we see some uses of the Valium. Valium is commonly used to treat a range of conditions including anxiety, seizures, alcohol withdrawal syndrome, muscle spasms, insomnia, and restless leg syndrome. Now we see what are those 7 greatest warnings for the beginner before Valium use. And you should not use Valium if you are: number 1, allergic to diazepam or similar medicines like Ativan, Klonopin, Xanax or others, or if you have myasthenia gravis, or if you have severe liver disease, you have narrow angle glaucoma, you have a severe breathing problems, or you have a sleep apnea. And one is very threatening thing about diazepam use is that it can slow or stop your breathing, especially if you have recently used an opioid medication or alcohol. And the misuse of this medicine can cause addiction, overdose, or death. Keep the medication in a place where others cannot get to it. Another thing which should be taken as a precautionary, that do not stop using this medicine without asking your doctor. You may have life-threatening withdrawal symptoms if you stop using the medicine suddenly after long-term use. Some withdrawal symptoms may last up to 12 months or longer. Get medical help right away if you stop using Valium and have symptoms such as unusual muscles movement, being more active or talkative, sudden and severe changes in mood or behavior, confusion, hallucinations, seizures, or thoughts about suicide. Valium should not be given to a child younger than 6 months old, and do not give this medicine to a child without a doctor's advice. Now we see how this medicine can be taken or administered, that is administration. To take this medication by mouth with a glass of water and follow the directions on the prescription label. If this medication upsets your stomach, take it with food or milk. Take your doses at regular intervals and do not take your medication more often than directed. If you have been taking this medication regularly for some time, do not suddenly stop taking it. You must gradually reduce the dose or you may get severe side effects. Ask your doctor for advice. Even after you stop taking this medication, it can still affect your body for several days. Overdosage. If you think you have taken too much of this medicine, contact a poison control center or emergency room at once. That's enough for this video. And if you want to know more information, if you want to get more information about Valium, please subscribe to my channel and see my other videos as well. Disclaimer: Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only. Thank you for watching the video. If you want to know more about side effects and other information of Valium, please subscribe to my channel Medicine Guide.